Hello and welcome to the Ronan Maher Show with me, Ronan Maher, and my very special guest, Alistair Haimes. Alistair, how are you doing?
Very well, thanks, Ronan.
Great stuff. Just to tell everyone at home who you are, Alistair is an investment manager turned data journalist, mainly via Twitter. But also he's been writing for the Critic, for the Spectator, for Hector Drummond's website. And he's, for the last 6 months, been at the forefront of data with regards to the COVID crisis, or rather the lockdown crisis, from my point of view, and probably many of you as well. So I've invited him on now because he's a superb communicator. He's very good at breaking down complex scenarios and complex data into easily understandable, succinct explanations. So Alistair, thank you very much for joining me.
It's a real pleasure to be here, Ronan. Thanks for inviting me.
Hey, my pleasure. So what's been happening? Crazy times, eh?
Crazy times. Yeah. The first wave of the COVID crisis is obviously long behind us now. Like all respiratory viral diseases, it went down to basically zero in the midsummer. And again, like all respiratory viral diseases, as we get into autumn, it's making a bit of a comeback. So the big question is, how big will the second wave be? Will it be a wave or will it be a ripple? Everyone is absolutely at full panic mode every time that any data is published at all, whether it's the daily hospitalization, cases, deaths, figures, the weekly ONS incident surveys, the surveillance reports. I mean, I've worked with data, all day, every day for 23 years. So I'm just used to the kind of the fire hose of data and information coming at me. And I've learned which bits are useful and which bits aren't financially. But if you're trying to be a kind of an armchair data analyst at the moment with everything that's being published daily, it's almost too much to cope with. Some of the media is more numerate than other bits, and even the numerate media sometimes focuses on the important bits and misses the unimportant bits, and vice versa. Very often they focus on the unimportant bits and miss the important bits. So yeah, it's a quite extraordinary position to be in. We're speaking, just for the record, it's the 18th of September, and schools went back around a kind of a week and a half ago, a couple of weeks ago, and cases look as though they're dribbling up. There's talk in the press about a second lockdown. Not clear to what extent the lockdown will be just pubs closing early versus everyone being ordered home to work. That's all being sort of telegraphed in the press. And we've got absolute chaos in the testing system. We've got chaos at schools. So it's I'm hoping that when we listen back to this in future years, we'll have a bit of a chuckle and think this is the kind of peak chaos. But I've been saying that most weeks for the past 6 months now.
Right. Yeah. And how did we get here? That's a question which I think needs to be asked, and I think it's one which you'll be very good at explaining. From early this year to now, roughly, how did we arrive at such a situation where we now have regional lockdowns? We seem to have different rules in different parts of the country. We have an increase in restrictions from today. For example, now venues which do not take details from customers as they enter the premises can be fined £500, which is an extraordinary invasion of the marketplace, an extraordinary collection of data on a mass scale, and much more besides. I mean, the Northeast is apparently the hotspot of COVID infections, and there's the claim that infections are rising constantly, as you just said, but the counter to that is that they're testing more, and what we really have is a case-demic. So yeah, how do we get here, Alistair?
Well, if you wanted me to summarise how we got here, Ronan, I think I'd recall that line from a couple of Bond films ago, where a dying Mr. White looks at James Bond and he says, "Mr. Bond, you're just a kite caught in a hurricane." The truth is that the main reason we've got in this fix is that we have this illusion of agency. We have this illusion that this tiny, minuscule, sub-microscopic virus is something that we can realistically control. And I think that's always been an illusion. And, the people who early on were trying to point this out, people like the German-American biostatistician Knut Witkowski, and then at Oxford University, Professor Gupta, Professor Gabriela Gomez, all these people who took a slightly contrary view to the SAGE and government view were silenced, not invited to SAGE meetings. When they put their views on social media, on YouTube and so on, they were taken off because they didn't go along with the WHO guidance. But all along, it's because we thought that there was some way we could actually stop this epidemic from progressing, as opposed to protecting the vulnerable who needed protecting while the wave of the virus crashes over us. And in fact, not even those eccentric or sort of marginalized people, but if you look at Sir Patrick Vallance, the Chief Scientific Officer, he was absolutely explicit in mid-March that the only way we're going to cope with this until there is a widely available effective vaccine is to protect the vulnerable while the virus passes through the healthy. That was the only game in town ever. The cocooning or shielding or herd immunity or community immunity, call it what you want. But that was the only approach that was ever actually available. And like I said, the first wave is now long behind us. We went below the epidemic threshold, depending on how you define it, certainly no later than 10th of May. So we didn't have any alternative through the first wave. I mean, there's no vaccine immediately on the horizon, so we're not going to have a vaccine available for the second wave either. So basically, I think the reason is that we could have gone down, if you like, the Sweden route. We could have gone down kind of mitigation and protection, and cocooning and shielding and all those things that made loads of sense and which centuries of epidemiology have proven to work. And then we've tried to have this completely unproven approach of trying to literally stop a virus in its tracks. Now you can do that if you get in really, really early, like New Zealand did famously. If you completely seal yourself off from the rest of the world and you completely stop civil liberties, you can maintain a fully susceptible population. And then the moment they uncork and the moment they open themselves to the rest of the world, the virus will find them there. And so I think that if I had to summarize the whole thing, we got here because we thought that we had much more agency and much more ability to stop something, which our human brains are just not designed to understand viruses or the way that epidemics progress or the inevitability of some of these biological processes. Viruses are very likely, some of the very oldest forms of life, if you count them as alive. Our brains just are not put together to understand how small they are. They're not designed, really. We're not designed to understand the way that epidemics progress. So I think that's probably how I'd summarize it. As to where we are now, we've got to a stage at the moment where in England, according to this morning's ONS incident survey, it sounds like about one in 1,000 people in England are currently carrying the virus that can lead to COVID. There's about 60,000 people currently infected in England. So if you think that we can sort of draw some kind of protective ring around all 60,000 of those people and stop them spreading it to people in the next week, then you're absolutely deluded. This is rapidly becoming endemic now, and we're already at the stage where there is no alternative but to go for herd immunity, not as a strategy, but just as an acceptance of that's how epidemics always die out, and the best you can hope to do is to protect the vulnerable, or maybe not so much protect the vulnerable, but tell them how to protect themselves. And in fact, when I read the ONS survey this morning, I was very, very pleased, because what it shows is that the virus is spreading at a rate of knots through young adults in particular, whereas it doesn't seem to be progressing at all in terms of increased prevalence amongst people over 70 years old. And that's exactly what you would want. You would want the elderly to be taking lots of precautions, and minimizing their risk, while the virus goes as quickly as possible through the healthy population, so that the virus will find it harder and harder to find the nooks and crannies where the vulnerable are, as it were, hiding from it. So that's probably a reasonable summary of how we got here and where we are now.
Thank you. Yes. Just go back to March and Patrick Vallance. I remember watching in horror as Boris, on that fateful weekend just before we locked down around the 20th, appeared to be going for, he was advising that people who are sick should self-isolate, but apart from that, we should get on with our lives. And then over the course of the weekend, he changed his mind under enormous pressure from the media, which was beating him over the head with the Ferguson Doomsday Report predicting that hundreds of thousands of people would die. It does seem that Patrick Vallance was probably behind Boris just before that weekend, telling him what to do. So I suppose in some ways the media and Imperial College defeated Patrick Vallance. Do you think that's a fair assessment?
Well, I think one thing I'd add to that is Macron. Macron was openly talking about sealing off the Channel Tunnel, sealing France off from England and leaving us as one kind of massive lazaretto. And the entire world was clearly going down one particular route. It would have been pretty ballsy of Boris to say, I'm going to do what nobody else apart from the Swedes is doing. It would have been a huge call. I'm not sure really what Patrick Vallance was thinking, because he was at the 10 Downing Street press conferences explaining very clearly how the community protection, community immunity, herd immunity plan works. And he was on Newsnight, he was on Sky, making it crystal clear. Sage minutes don't record that there was ever an advice to do a full lockdown rather than more incremental social distancing. But then obviously in the last few days, an email has suspiciously been released into the public domain, which I think seems to say that Vallance was sort of claiming that he was all in favour of an earlier lockdown. So I'm not entirely sure what guidance he was giving. As for Sage, the problem with Sage, I think, and it's easy for me to sit outside and not being a scientist, but it didn't seem to have done a very good job of making sure that there was a devil's advocate on the committee. In investment, we always try and challenge our theories, and if you have a committee, you ideally could nominate someone to be red team in a very sort of Dom Cummingsy way, to sort of challenge civilly and politely, but to sort of challenge and provide some scrutiny. Whereas it does sound like the epidemiology people who were on Sage were all coming out with exactly the same, like suspiciously the same recommendations and models. And meanwhile, outside of Sage, you had teams like the Oxford team with Professor Gupta coming out with completely different readings of identical data. And, I think it was a bit remiss of them not to invite them on to say, hang on, you're highly qualified, you've got the same data, why have you come up with a different view? So I think maybe the way Sage was put together wasn't terribly well thought through. And also one of the problems with people like that is although they might give a range of forecasts, it's only ever the worst forecast that will make it into the media. And if you have someone who's sitting in the committee who's not used to hearing these huge numbers, they will only focus on the biggest number. So you will automatically go down the most protective route for COVID. It doesn't sound like anyone ever put their hand up and said, hang on, if we go down this lockdown route, what's that going to mean for the rest of the healthcare system? If we're effectively shutting A&E departments, booting sick people back to care homes, closing GP surgeries, what's that going to mean? Even if you leave aside the fact that they're really looking at 3-week lockdowns, so they probably wouldn't have looked at economic consequences, which obviously the worse an economy does, the worse healthcare goes. They may have left that to the side, but there seems to be no sort of cost-benefit analysis at all. And a few people have said that there should have been an economist on Sage, which I completely agree with, not because economists look at money, but because economics is the study of decision-making under uncertainty when you have limited resource. It's all about costs and benefits and the realization that, if you pull a lever, it's attached to more than one cog. whereas SAGE looks like it was just attacking this one problem as if there was no other consequences. So kind of course, the way it was put together, they would come up with the most risk-averse way of dealing with just that one problem without thinking of the impact on the broader health system. And that's why I think lockdown has been such a huge killer, because it was never considered as the obvious consequence of COVID. And for all the brilliance of the minds on SAGE and for all the intricacy of the models, it's quite clear they never even broke out care homes as a separate line in their model, even though that's about 40% of the deaths. So yeah, I mean, the inquiry is going to have to focus on. I mean, frankly, I just couldn't care less about blame allocation. But there will be another epidemic, probably in our lifetimes. Ideally, they will learn the lessons of how to put a better committee together to make sure that expert failure isn't an absolute given from the way it's constituted.
Yeah, the inquiry. My concern with the inquiry is that it is going to be framed kind of in line with, rather, it's going to be framed to reflect Parliament and Parliament's opinion, which is overwhelmingly pro-lockdown. And where it's criticised, it focuses on lockdown not having been imposed early enough, rather than on whether the lockdown was the right way to go in the first place. Do you think that's where we're going to go with the inquiry, or do you think it'll be more open and Professor Gupta and Carl Hennihan and other dissenting voices will be heard?
Well, that's a very good question. I think I'm probably one of the few people from the sort of lockdown skeptic side of the argument who doesn't think that the inquiry should be done very soon. I think the Swedes, who basically called all of this right from A to Z, they think it's going to take maybe 18 months or so to work out which country did things right and which country did things badly. So I think we need a little bit of perspective. I do think it'd be much better to have, however many waves there are going to be. Hopefully there's kind of one big wave and one tiny ripple. But I think it needs to be in the rearview mirror before we can really take the lessons away from it. But I mean, yeah, I hope they make it as wide-ranging as possible, and I hope they focus on how to really focus on it, not happening again. But I mean, one thing that makes me just despair is that I'm looking at today's surveillance report, coronavirus surveillance report that's released weekly. It just doesn't seem as though we've learned any of the lessons from the first wave. Just when the second one's starting, I looked at the detail this morning, and in the last week, there's been 228 COVID outbreaks in care homes in England.
Yep.
That was the only thing we had to do in March. It was the only thing we had to do now. And it just looks like we just don't seem to be able to organise our systems, whether that's PPE, whether it's testing visitors and people being admitted, whether it's making sure that care home staff aren't moving between care homes more than absolutely necessary. But the one thing we had to do was keep it out of care homes, which, like I say, that's 40% of the deaths, even though they account for, I think probably roughly 1% of the population, I think, are in care homes. They account for 40% of our deaths. So very clearly, that's the one thing we had to make sure. And it just looks like we're making the same mistake again. So in the last week, everyone's now talking about closing down hospitality for half term or maybe even longer. Last week, even though we're at the tail end of Rishi Sunak's, Dishy Rishi Sunak specials, the Eat Out to Help Out scheme, there was only 25 outbreaks last week that were traced to food outlets and restaurants. 25, and there's 228 outbreaks in care homes. So, we do the intervention where it's not required, and then we don't do the intervention where it is required. Makes me tear my hair out.
Yeah, it's incredibly frustrating. Just to play devil's advocate slightly with the care home situation, I wonder to what extent it actually cannot be stopped. I wonder if there's the analogy of the fence around the building and trying to use that fence to keep wasps out. I wonder if it's inevitable that the virus is going to move around. Now I know basic laws of physics. If you keep particles separate at all times, then sure, if viruses are among them, they're not going to cross-contaminate. But it seems, practically speaking, that it may be extremely difficult to keep the virus out of care homes, unless the staff are wearing hazmat suits, maybe, and are sort of hosed down with Dettol as they enter the building and all the rest of it. What do you think of that?
Well, I think that's a very good sort of null hypothesis to have, actually. I mean, if I was to kind of challenge that, what I'd say is that, you know, if you or I were in charge of allocating the number of tests that the country has now, we've got hundreds of thousands of tests we can do, probably a couple of 100,000 tests we could do a day. Given that we know the number one important thing is to keep the virus out of care homes, you know, I do first, actually, in fairness, I will say they do seem to be prioritising testing at care homes. So maybe they're finding outbreaks because they're testing there. So I'll give them that. But, you know, for example, if you were to visit a care home, maybe it would make sense that you have to be tested, you know, maybe 48 hours apart. 2 negatives 48 hours apart means that you can visit your relation who's in a care home. That would seem a relatively sensible use of 2 tests to me. You know, maybe really trying to tackle this problem of the agency staff going between the care homes. Maybe that would be sensible. But more broadly, in terms of all of the policy levers that have been pulled, one of the problems with the lockdown is that it's universal, not just regionally, but it affects all age groups. You know, so the 20-year-olds have been just as locked down as the 80-year-olds for the last 5 or 6 months. Now, I'm not sure that is the way to minimise mortality, even for COVID, in that you're basically delaying the young reaching an immunity level. I'm not going to say necessarily herd immunity, but an immunity level where it's going to be less likely that they're going to be carrying the disease at any point, carrying the virus at any point. So what you'd really want to do, if you could design your own epidemic, is you would want it to pass as quickly as you humanly could through people who wouldn't be vulnerable to the disease that the virus causes. Right? So you'd want, looking at the age profile of people who really suffer from COVID, you would roughly want this to pass as quickly as possible through everyone under about 40 or 50 years old, because then they're much less likely to be carrying it when they bump into someone who's 80 years old. You know, and meanwhile, while that's happening, and until incidence gets down to some sort of pre-agreed level, you do say to elderly people, listen, you need to take care. You know, if you think masks make a difference, wear the masks. You know, really take social distancing and ventilation and, you know, hand washing, take all that stuff ultra seriously while the virus is passing through the people younger than you. In fact, there was a Royal Society paper written a couple of years ago that made this exact point on how to deal with an epidemic, you know, by not taking blanket approaches to how it should pass through the population, taking differential approaches by year group. It just seems to have been completely ignored. So I think the problem is that our interventions have they may well have made the COVID outbreak worse by not allowing it to pass through the healthy. And they've certainly caused all kinds of health disasters, particularly on cancer referrals for everyone who COVID wouldn't have affected. But I do take your point. Maybe it was always impossible. Maybe we're always kidding ourselves that it wouldn't get into the care homes. But, you know, with the benefit of hindsight and with the benefit of a bit of analysis, given that the tools you've got are the various social distancing levers and the testing, you know, I don't think we've used either of them in the best way.
Yeah, I mean, I broadly agree with you. I'm just playing devil's advocate with it, really.
Yes.
And beyond the care homes, which I think you know, the decision in mid-March to discharge people from hospitals into the care homes was obviously catastrophic, and obviously stupid, perhaps even criminally stupid. We will find that out in the future, I hope. But the situation in schools, your children have had problems, haven't you? You've had problems trying to get them back, and your little girl was sent home the other day, wasn't she?
Yeah. Oh God. 4th day of school. Yeah. She's missed 6 months of school, and then 4 days into the 4 days into the term back, she's just gone into senior school. One of her classmates, her cough, obligatory school protocol kicks in, has to have a COVID test, comes back positive. So I think 25 kids from her class have been sent home for a fortnight. And the guy who tested positive is a boarder, so the entire boarding house is locked down, or quarantined. So that's 45 kids there. So 70 kids are about to miss out another fortnight of school. because of a boy with a cough who's now absolutely fine. He's 13 years old. The virus was never going to be any challenge to him. Most of the parents, most of us parents, and most of those kids are in our 30s or 40s. The virus will be no risk to us whatsoever. And meanwhile, another fortnight of education. I've got 3 kids in different classes, in different years, in different houses. So the chance of this not being a kind of World War I style rolling barrage of quarantines is basically next to nothing. So I've just kind of written this term off. What I'm hoping is that, again, I'm hoping that we'll look across the channel and copy a much more sensible idea. Because I just had a WhatsApp message just before we started this call from a friend in France saying that they've got a new policy now in France whereby if a kid tests positive, they have to isolate for a week, but nobody else in the class has to do anything unless they get symptoms. And that's plainly a much more sensible system. But meanwhile, we've got schools and year groups closing by the hundreds at the moment. It's a completely unsustainable situation, particularly after kids have already missed 6 months of school. So it's absolutely, the school situation is absolutely disastrous, and I just hope they pivot away as quick as they possibly can now.
Yeah, it just seems to me that problems that the government and the opposition in particular, if you can call it opposition, focus on, like inequality, are only being exasperated by the situation. So I think it's one thing if well-educated middle-class people like you have children off school and at home, but the situation in poorer, less educated sectors of society is quite different, isn't it?
I couldn't agree more. I could not agree more. I mean, this whole use of lockdown and the interventions is going to be an absolutely peerless social inequality wedge. I mean, the public schools, when you're quarantined, you just have to join the class by Zoom, you get electronic homework, the support you could possibly want. Whereas, a lot of the state schools are just closing. The state schools in poorer areas in particular, the exact places where you need to get the education system up and running again as quickly as possible. They're actually going to have much less support. So the longer this policy continues, the more the damage to social inequality. I think I read a report saying that the 6-month lockdown may well have undone a decade of closing the attainment gap between the richer and poorer. And I mean, just how much longer can we tolerate it? It's just like you said, a lot of the middle classes, if you go home, just as you work from home from your computer, pop out into the garden every now and then, it's really, it's not that much of an intervention. Whereas, if you're young and less privileged, you might be sitting on a laptop in the corner of your bedroom trying to dial in or work, or much more likely you're either furloughed or trying to get a non-existent job. So, in terms of social inequality, they need to get this lockdown lifted in full, particularly for the schools, as quickly as possible. They need to kind of run, don't walk to getting this sorted out. I couldn't agree more, Ronan.
Yeah, I mean, I've heard awful stories about children who are at home with, alcoholic or drug addicted parents, or just one of those, no internet, hardly any food in their stomachs, just dire situations where, where ordinarily school is a bit of respite for the kid,
Yes.
away from the horrors of home life.
Absolutely right. And I know a lot of the teachers are tearing their hair out about it. I've got friends who are teachers at not great schools, and they're not allowed to follow up on whether homework's been done because still so few of their kids have got the sort of electronic devices or Wi-Fi or anything like that, or they haven't got the home environment conducive to catching up on homework. So huge numbers of the underprivileged have just literally had 6 months of no school. So it's going to take them a while just to catch up with where they were, never mind kind of rejoining their educational journey where they stepped off it. I mean, I just hope it's being tackled inside government with some of the urgency that we don't see from outside. Because if this carries on for the rest of this term, it's going to be a complete write-off. I'm in Bristol. I think we've got 6 schools now, as of last night, that have got outbreaks which have led to either year groups or schools being closed down. That's just in one smallish city. So, you add another couple of weeks of the virus being detected when kids with, the normal seasonal bugs get tested, and the whole educational system is going to fall apart before it's got going again. Yeah, I mean, I say that should be the number one priority for government. If anyone was listening into this, I would say drop everything and sort out the guidance for schools. They have isolating contacts of positive cases makes absolutely no sense if the other kids themselves would be at no risk, and if they live at parents who'd be no risk. I mean, maybe say your child was very close to an infected child, a child who's tested positive. So if that child happens to live with somebody who's 80 plus or has kidney disease or severe diabetes or something, maybe they should be allowed to stay off for 2 weeks to isolate. But someone like my daughter, she's super healthy, I'm healthy. There's just no reason for the vast majority of kids who are now going to be isolating to isolate. And coming back to what I said 10 minutes ago, every time you do that intervention, you're slowing the spread of the virus through the healthy, which means that you're making the susceptible, vulnerable population more likely to encounter the virus. So, it could not be a worse policy.
Yeah. It seems like total madness to me, and it seems to stem from the stigmatization of the term herd immunity. This equivalent with, I don't know, genocide or something like that. Oh. Again, this is our media, though, isn't it? Totally irresponsible, totally thick in many ways, I think.
Well, I mean, the herd, to give the media, to cut them a little bit of slack. When I heard the press
let's not cut them any slack.
Okay. So let's imagine I were to cut them some slack. I would say that the words herd immunity, okay, it might be the technical term in epidemiology, but can we not come up with a nicer way to describe humanity than a herd? It just, we don't like to think of ourselves as animals. If it had instead been, so if we'd instead made people think that by embracing the strategy of allowing the virus to pass through the healthy so that it could pass over the vulnerable, if we could have found better marketing, and emphasizing the agency of sort of embracing that as the only way through, and stressing that the community immunity, I think it would not have had the reception it had. But there is a kind of a knee-jerk reaction as humans to being compared to animals. So I really wish they'd rebranded it first. I mean, it's of a piece with the fact that you have scientists who are used to talking to each other in scientific committees. It should really pass through a kind of a marketing or PR think group before they say it to the public. If there's going to be a knee-jerk reaction against the term herd immunity, just a little bit of rebranding, and maybe we'd now be following the Swedish route, and we'd be long out of this mess.
Yeah, I do take your point. I just wonder if it's got more to do with the media being so anti-Tory than the term itself being, perhaps perceived as dehumanizing.
Yeah, maybe. I mean, the media gives their punters what they want now, and people do seem to be really enjoying being terrified. It's like you're sort of trapped in a contagion movie, and all these statistics, which are very any statistics that's moving in the right direction is just not reported, and anything that is going in the wrong direction is absolutely gleefully reported. And you can see the comments sort of lighting up below the tweets, and you can see the lurid headlines. They're obviously giving people what they want. And as a result, the more the public reads it, the more they kind of brave for harder and earlier lockdowns. I mean, it's almost like the Romans sort of begging to have the bread and circuses taken away from them. And then the more they say that, the more the media will give them what they want, and it becomes a kind of horrible, kind of self-reinforcing, circle. So I don't know quite how you kind of pull a handbrake on that or short-circuit it. to get out of it. I do think the original kind of presentation of it was flawed, and probably the most cack-handed thing is when it looked like the first wave was gone, was then standing at lecterns with hazard tape all around them, telling people it's safe to go back to work. I mean, it's just, you spend 3 months telling people there's a shark in the water and then you tell them to go swimming. Absolutely ridiculous. So, yeah, maybe one other thing that needs to be sort of beefed up is the PR side of the 10 Downing Street's presentation, because they do seem to be giving extraordinarily mixed messages. You know, they're telling us to eat out to help out, and then 2 weeks later, it's the young people's fault that the virus is spreading because they relaxed too much, according to Van Town. I mean, do you want to incentivize people to go out more, or do you want to tell them off for going out more? It's got to be one or the other. So, rant over.
Oh, I mean, I couldn't agree more. The messaging has been absolutely awful. And just rewinding there to the media for one moment. Yeah, I think the age-old newsroom mantra, if it bleeds, it leads, is at the heart of the problem. There's no such thing as good news, really. Bad news is good news.
Yeah. And if you've ever wanted an opportunity to land a good punch on the government, this is it, in spades. Every wrong move can be absolutely celebrated. And if just to be fair to the government, if you go back to March, it actually wasn't entirely clear what was coming. And to be honest, the original lockdown, 23rd of March, I supported. And if I was tyrant, I'd have done exactly what Boris did. I'd have said, coming out of winter, the health system is fairly full still. We can see what's going on in northern Italy. The parameters of the disease are still very unclear. The treatment protocols are still very unclear. And so we're going to have a limited 3-week, shutdown for all those things to clarify and to build capacity. And then we're going to revisit it. And I think that was actually a sensible move. The only problem is that it ain't mid-April anymore. And they kept renewing. Obviously, Boris getting ill was a complete nightmare. But the original lockdown, I think that was, I still think that was justifiable. But I think by late March, it was clear that it wasn't growing exponentially, which is it's a word. Exponential is now a word that it's like fingers going down a blackboard for me. But it clearly wasn't growing exponentially by the end of March, and by mid-April. By about mid-April, I think it was very clear that the health system wasn't going to be superseded. It wasn't going to be breached, as it were. We weren't going to run out of capacity. We didn't need 18,000 ventilators at all. I don't think we've ever used 1,000 ventilators. It was clear enough in mid-April that social distancing should have been rolled back. But I still cut the government slack for the mid-March original lockdown. Even if Sage weren't recommending, I can see why it would have been such a big call to make at the time, particularly with all of Europe doing something different. I can still see why they came to that decision. But at almost every point since, it's been very clear that the correct approach was the Swedish approach. They just never had the ability to realise they made a bad trade and to get out of the trade with the minimum cost. They could have just put their hands up and say, hey, we were overcautious. Isn't that the right thing to do with people's health in our hands? But it turns out we did more than was necessary. So we're going to now mimic a country that clearly has taken the right approach. So I give the government good marks early on, and then progressively worse marks virtually every week since. I think.
Yeah, I broadly feel the same way. I have very sort of libertarian instincts, but I think it's easy to stand on the sidelines with those instincts. If you're in government and the fires are going off all around you, you're going to inevitably reach for some kind of an extinguisher, aren't you?
Yes.
So it's yeah, and that's fair enough. They did well at the beginning, but after it became clear that it was nowhere near as serious as first feared, they should have took the foot off the pedal, really.
Yeah.
And that didn't happen.
Actually, and also to cut them a bit more slack, I think Rishi Sunak's scheme worked brilliantly to get people not only back into kind of supporting restaurants and so forth, but also used to going out and getting used to the idea that you can go out and then you don't die. Just literally getting people out of their houses and moving again. And you can see this is why the virus has spread so much through the relatively young people, is because Rishi's scheme was so successful. It's fantastic. The complete triumph. I actually think the furlough scheme probably is also going to have preserved an awful lot of jobs that otherwise wouldn't have been lost. So, all fantastic. And now all of a sudden, it just looks like we're going to make all the same mistakes again. It looks like we're going to close down the parts of the economy that don't need to be closed down. We're going to protect the parts of the population that don't need protecting. And we are not going to, take the measures required to keep the virus out of the exact places it needs to be kept out of, which is basically the hospitals, to stop nosocomial infections and care homes. So, I can't give them high marks for repeating all the same mistakes twice now that we know much more about the virus, the disease, and more effective ways of using the policy levers they've got.
I'd like to have you talk a little bit about the furlough scheme, because I'm very critical of it. I think it has led to a situation where I can see my closest city, which is Manchester, looking like Detroit in a few years' time because of the furlough scheme. Not just because of the furlough scheme, but I think it's certainly playing a big role. London too is emptied out in the centre. You're Bristol, aren't you?
Yes, that's right. Yeah.
What's it like there?
Well, most offices are somewhere between roughly a quarter and a half full, which is partly because people have been allowed to carry on working from home, because of if they're worried about the virus, and partly because the social distancing measures you need to do in offices just mean you can't run them at capacity anymore. I know where you're coming from, Ronan, and you've got the kind of the twin moral hazards. That first of all, it makes people think they've got a job that they really haven't got, and they're kind of like Wile E. Coyote that run off the edge of the cliff and legs are spinning and they haven't realised they're about to hit the floor. So there's that. There's also the problem that while people are furloughed, they're perfectly happy to be locked down, and that actually, if more of the public was just braying for normal life to resume, that might help the government to change its policy. So I do get the arguments against furlough, but equally, I do suspect in the round that it is easier for. I think companies are probably more likely to retain someone with the help of the furlough system than to have decided, hang on, this is going on for so long, I'm just going to reduce the workforce. And I would imagine that they wouldn't then have ended up rehiring as many people as the furlough scheme would retain, if that makes sense. I've got no proof for it at all, but it's just a gut feeling. I've just got a gut feeling that the scheme will have probably saved really quite a few jobs. And again, I think Sunak's probably worked out also that there's a lever you pull that's actually attached to two cogs. So if you do let the furlough scheme lapse in its entirety, you still end up paying those people. It's just you're paying them universal credit rather than furlough. So I'm not sure how much of a money saver it would be to turn the furlough scheme off anyway.
I have about the same gut feeling in the short term. My concern is that in the long term, we will have taught a lot of companies that they can outsource to Bangladesh, India, and so on, and that people who are working from home at the moment need to keep that in mind. That I mean, look at us having a conversation now over the internet, quite clear.
Yes. Although our listeners don't realise we had 20 minutes of trying to get the audio working before this started. Actually, I don't know. To be honest, Ronan, whenever I've been in a few ups and downs, a few recessions and busts and things since I started work, and it always looks like the future is going to be much more different than it actually ends up being. You're trying to work out what the future looks like when you're in the middle of a big episode is really, really difficult. I remember working in London just after 9/11. There's police absolutely everywhere. And people were saying, well, you'll never get anyone to work in a skyscraper or live in a skyscraper again. And, people aren't going to be using planes regularly anymore. 6 months later, that was all forgotten. Same as after the 7/7, attacks. You'll never get people to go on buses again. completely forgotten 6 months later. So when you're right in the middle of these things, it's really tricky to work out just how different the future will be. I'm sure it will be different because people have had a 6-month experiment of working from home, but they've had that experiment during the sunniest spring ever, and a pretty decent summer as well. I wonder how much, particularly once sort of more than half their workforce are back, and I wonder how much they want to be the people who are still at home if it's a really miserable, freezing cold January day. I suspect the future might be quite a bit more normal rather than new normal.
Well, I like your optimism, and
I'm the
I
last
take your
optimist.
point. I take your point. I do. Moving it slightly away from that section, civil liberties. This is something now which I'm also very worried about. Milton Friedman line about nothing being so permanent as a temporary government program. I'm worried that that's going to be the case with the enormous reach into our personal lives that the government has undertaken here. It's alarming. £500 fine now for venues that don't take details down, as I said earlier, and the rule of six and all this quite incoherent nonsense. But nevertheless, we are giving massive powers to the police, and of course they've also now started to employ so-called COVID marshals, which sounds to me like the Stasi or the Cheka. What's happening here?
Well, I think we need a root and branch look again at how these statutory instruments are used. The COVID Act was passed in a real hurry back in March when it was clear that Parliament was going to have to be suspended. Action was sort of needed now because it looked like there was a train coming down the tunnel at us. It was a real hodgepodge, a ragtag act. It kind of hangs off another act, the 1984 Health Act, which kind of was actually kind of well thought through. But since then, Matt Hancock has basically been able to pass the laws he wants. You pass these statutory instruments at 1:45 and they come into effect at 1 minute past midnight. They never actually pass through scrutiny. I mean, I don't know how kind of politically plugged in you are, but I had no idea of these made negative and made affirmative ways that statutory instruments could be laid. They might be subject to future scrutiny, but maybe not for a month afterwards. It's the whole system. I mean, it really doesn't. I had just very innocently assumed that laws that are passed that would affect me go through Parliament, go through some kind of process of scrutiny and challenge and debate. But it turns out that we can actually just sign our rights over, and they can be passed by diktat and fiat. You look at the rule of six is actually a really good example. I mean, when was it announced to Parliament? It was announced to Parliament after it had already been announced as at number 10. Yep. Well, that isn't the order these things are meant to be in. It's meant to be passed in Parliament as a law, and then the country's told about it. It's very far from clear it's required. It's very far from clear it would make it through Parliament if it was debated. But I really hope there is some more scrutiny and challenge of this whole way of allowing statutory instruments to depend from acts that were passed, frankly, in a bit of a hurry. I know the Coronavirus Act is actually up for renewal at the end of September because, thank God, someone managed to get a 6-month review rather than it staying in place for the full 2 years. I think there's no prospect of it being voted down, but if it was either voted down or amended such that statutory instruments would be subject to some kind of parliamentary scrutiny and vote first, that would be, I think, a very good thing. I share all of your reservations, really. I'm absolutely alarmed. I think the COVID wombles is going to be an absolute farce. The idea of some sort of lollipop lady telling a group of beard-up 20-somethings to disperse is going to end in absolute shambles and chaos. So I don't know quite what they were thinking there. But yeah, these rules seem completely arbitrary. I mean, show me the epidemiological paper that says that 6 is the right limit for, to reduce the spread of the disease. It just seems completely random. It feels like there's kind of a random policy generator that's spun, and they sort of reach their hand in and pull out the kind of the fortune cookie script of what the next policy should be. It's extremely unclear. If there is any evidence behind it, it's not explained. So yeah, no, I 100% agree with you. Just just like you said, it's once you've kind of let the genie out of the bottle of giving people a sort of taste of ultimate power, I just hope we can put the genie back in the bottle. And history isn't encouraging, but what is encouraging, I think, is there's a lot of voices from the back benches who are pretty outraged about this. And maybe it's topical also to say that those same voices who are outraged are also the same MPs that Boris really needs for the upcoming Brexit shenanigans in the Commons. So I'm hoping that he might give them, he might listen to them more than he necessarily would normally need to. But yeah, I think this is something that when these current clouds have cleared, I'm not hopeful, but I would be very pleased if there was a bit more challenge on whether this is the right way for us to pass laws, or whether we need some kind of dead man's handle when they are passed. I mean, maybe when it was originally passed, if they said that this is the intervention that comes in when this metric, this bit of data goes through this particular threshold, and it'll be reversed when it goes through that threshold. And if we had some kind of visibility on how they're making these decisions, I think people would actually kind of accept the interventions much more willingly. But it seems to be made up as it goes along. And I do think it all comes back to this idea that they think they've got much more agency over controlling the virus than we ever actually have.
Yeah, and very, very good. They do seem to believe that they can control things which seem wholly uncontrollable to me, and that's very worrying, because again, it speaks to the idea that they believe in their powers. They think they have magic powers, perhaps.
Yeah, I think maybe they've set a false opposition up in their head. I think maybe they think that if they couldn't control it the way they think they're controlling it, the only alternative is to do nothing. But actually, it might be a really positive thing for them to accept that, hang on, we can't stop the spread because this thing's had a billion years to evolve ways of evading cells that are trying to stop it getting in. But what we have got is we've got tests and we've got interventions we can use intelligently. So we can't stop it. Our interventions won't be 100% successful, but given those limitations, given the scarcity of our resources, what's the really intelligent way to kind of draw a perimeter around the vulnerable and sort of protect them? What's a really intelligent way to use all the tools we've got at our disposal? And it doesn't seem like they ever actually sat down with the people who could have helped them, like Professor Hennigan at Oxford University, who was speaking at the Science Committee yesterday in the Commons. He seems to have very, very clear ideas on how you use the PCR tests, on which parts of the population to protect and which not. And it just looks like they didn't sit down and try and write a plan, assuming that they didn't have complete control, which means they didn't ask the people who could have helped them. So I wonder if that's part of the problem of why it's gone wrong is, as ever, if you don't ask the right question, you won't get the right answer.
Absolutely, absolutely. Do you think we're going to see any change in the coming weeks?
Well, all the kind of the smoke signals are not encouraging at the moment. It seems to be second lockdowns, curfews, extra work from home orders. So the signs are not good, and it's terrible news that it sounds like the outbreaks have got into care homes and then back and forth from the care homes to the hospitals. Certainly, that's happened in Tameside. So that's not good. I think what we need is we just need to accept, I think, that the government has sort of got itself in so deep, like kind of, like Macbeth or like General Haig. They're so far in that realistically they are just wedded to this quasi-zero COVID suppression strategy. And it looks like they've given up on the kind of the mitigation, kind of flatten the curve strategy. So I think the only thing that will save us really is a combination of taking the advice of people like Professor Hennigan and using the tests we've got more intelligently so that we're minimizing false positives and weak positives so that we're minimizing the disruption to people who don't need to be disrupted, using the tests much more as a scarce resource, so really targeting them at the hospitals and care homes And I think they are starting to do that, so I'm hopeful there. But I think what we need basically is at least a few days of data where it's clear that this second wave of ours is not going to be like the first wave. Because if it does start taking off, going through the roof, then it doesn't matter what the rest of us say. The government has, we know exactly what tracks it's going to be on. But if we see that it's actually growing slowly enough that the health service will definitely be able to cope, and I'm hoping there might be some way of kind of talking them down from the precipice. I mean, there's absolutely no prospect of us running out of ventilators. I think we know that for sure now. And that was the number one thing I remember from the news, is we have to shut down because we're running out of ventilators by the second. Well, now we don't. Ventilators are very rarely used for COVID now, so we're not going to run out of those. We've got the Nightingale hospitals under dust sheets, and the hospitals have never been emptier. So as long as it grows slowly, it will grow, because respiratory viral diseases grow in winter. I mean, that's what they do. But as long as we know for sure that the NHS will cope, then there might be a way to kind of have another narrative. But if the data takes off again, then it's all hope is lost, I'd say. So we just need a few days where people say, "Oh, hang on, it's not taking off exponentially; it's growing, but very, very slowly." And preferably, even it'll be fantastic to see it topping out and starting to decline. I think there's the first signs of that in Spain already for their second wave. It's certainly the cases don't look as though it looks as though the cases are coming down rather than going up. Hospitalizations seem to have stabilised, and the deaths are. They have more decimated in midsummer, but the deaths are stable and at a level which is not even a fraction of what they had in the spring. In Spain, about sort of 60 to 70 people a day are dying at the moment. But that's in a country of tens of millions. We won't have it down to zero while this virus is becoming endemic. So I think the main thing we need is for the numbers to move in the right direction consistently for at least a few days, just so that the ministers don't panic and they don't feel as though they're being kind of bounced into a huge intervention, which would be avoidable. And if just a few days' data gave them the escape space to think a bit more rationally. But also, we need to pivot to using our testing in a much more sensible way. And I was really encouraged to watch Professor Hennigan at the Science Committee yesterday, because he seems like he understands the tests, from A to Z. He knows exactly the reasons they've been throwing up, the wrong conclusions for policymakers, and he seems to have a plan to get us out of it. So I was heartened he was invited to speak, and I was pleased that they let him explain things fully. I just hope something comes of it.
Me too. There was a journalist, she called Eloise. She's on the ground there reporting from the Science Committee.
Yes.
She did a blow-by-blow of Professor Hennigan's findings, and I highly recommend reading them. I'll put that in the comments below this podcast when I post it. Yeah, Carl Hennigan's been fantastic, hasn't he?
Oh, I mean, at every point, he is a true national treasure. He's just in the last couple of weeks, he's worked out that PHE was Public Health England was massively overstating the death figures, because if you get knocked over by a bus having previously had a positive COVID test, you're a COVID death. Well, I mean, give me a break. The Scottish hospitals, he worked out that people they're in hospital for completely unrelated reasons. But if they previously had a COVID test, a positive COVID test, they showed up as a COVID case. That reduced hospitalised COVID patients by about 80%. He worked out that the Welsh were also hugely overstating their hospitalised figures. Everything he looks at, he seems to find calamitous misstatement. I don't say intentional, but candid use of the data. And also now on the actual tests, which are kind of hanging like a sword of Damocles over kids in the working age population. He's done several papers now pointing out that we're finding fragments of viruses that might have been cleared 2 months ago, and people are tens of thousands of times lower concentration than would be required for them to be infectious, but they're still being just triggered as a binary positive rather than negative. But thankfully, having pointed it out, it does sound like Public Health England is going to be changing its guidance. Well, is changing its guidance on that. So, yeah, he has the fact that we're not currently in a much, much worse situation is largely thanks to him. So, yeah, chapeau.
Yeah, just to say that the journalist I was talking about before is called Jade Eloise Norris. I want to give a shout out to her because she's been fantastic. Yeah, the testing picking up dead viral fragments is alarming. It really is. It makes you ask, just how many of these people, are sick. How many of these cases are truly representative of sick people? And of course, that's before
Exactly.
you even cut down into how many of the people who truly tested positive are actually symptomatic.
Well,
And
even more fundamentally, Ronan, what is a case? Like the number one thing that's in the front of the papers every day is this many cases. What is a case? I mean, this is a disease. You'd normally expect a disease as a kind of minimum to make you ill. Yeah, so we seem to have and in this case, you could verify which particular thing is making you ill by, once you've got the symptoms, giving you the test to see if you're carrying, significant amounts of the SARS-CoV-2 virus. That to me is a case. But what's being reported as cases in most, but not all countries, is anybody who will trigger a positive on a PCR test, regardless of the amplification. And the amplification levels on all these PCR tests seem to be turned up to the absolute max. So it's like the fable of the guy who had a grain of rice on the chessboard and it was doubled on each square. We're running these PCR tests. It sounds, from Professor Hennigan's papers, it sounds like we're running them about 10 cycles of doubling too high to test whether someone's infectious. Now, that's not 10 times too high, that's 10 doublings too high, 2 to the power of 10. So, 2, 4, 8, 16, 32, 64. So over 1,000 times higher than they would potentially be infectious. And, it's 6 months into the epidemic before someone's pointed this out. I'm not even sure that what we've been declaring as cases are cases. If someone's asymptomatic, but they trigger a test, should be reporting that as a case? I don't think the Chinese do. And I think it sounds like a lot of countries in Europe are running their PCR tests about 10 cycles lower than us. So this is one reason we can't really compare one country with another. We're running the same tests, but on different settings. And then some people are declaring cases if they're symptomatic and some people aren't. So it's quite possible, for example, just to go back to my own children, it's quite possible the lad who was coughing in class, in my daughter's class, had a completely unrelated virus, and that the test was picking up tiny fragments of the virus he might have been infected with 2 months ago, but his system's still clearing them through, in which case he's isolating for a fortnight, as are 70 other kids from the school, for absolutely no reason. And it's because no one's actually sat down and thought, hang on, we've got this test, but what are the right parameters to run it with?
that is truly crazy. Why have we decided to turn the volume up on testing relative to other countries? And I mean, it kind of looks like they're desperate to find as many cases as possible.
I'm a real believer in Hanlon's razor. The unintentional cock up and things just going wrong rather than conspiracy. I think what it is early in the epidemic, when all the parameters are really unclear, you think, well, we don't know quite how dangerous it is. We don't know quite the level at which we have to set these tests to find the levels of virus that would be infectious. So we're going to turn everything up to 11, like Spinal Tap. Just turn everything up to full, and we'll worry about refining the parameters later. But the problem is they never came back to refine the parameters. And it's left to other researchers, again, like the sainted Professor Hennigan, to work out, hang on, it looks like I can set the thing 10 whole doublings lower than you've got it set, and I still can't find any samples that I can cultivate into infectious virus. So, I cut an awful lot of slack to everyone on this for the first month or two when things were unclear. But after 6 months, I think patients should start to run thin.
Yeah.
In other words, you want maximum inclusivity at the beginning. So again, can we go to Public Health England? Anyone who dies who has tested positive, let's just get them in the figures, just so we don't miss anyone out. Let's set all the tests to maximum. Let's just be maximally inclusive so we're not losing any data. I get that. But, urgently, as you pass through, you need to work out what the right settings for all the data and all the reporting are. And it just looks like they were never interrogated. It was set on day one, and they were sort of set and forgotten. And I do think that it is a large part of the reason for the fix that we're in.
Yeah, I mean, I always say this, and it's that I'm a rational explanations type of a guy. I resist conspiracy theories, which is not to say that I don't believe that people conspire, because of course they do. But conspiracy theories in terms of, the moon landing was faked and all this sort of stuff, I tend to push that away. I have to say though, with COVID recently, I found that put under quite a bit of pressure by just how crazy everything is. It makes me wonder to what extent not was the pandemic planned. So pandemic is the term, isn't it?
Oh yeah.
I don't think that's the case. But I wonder just how much of Machiavelli's dictum about never letting a good crisis go to waste is in action here. And you got, for example, the green lobby is very powerful, and there's people who believe that we should return to some kind of agrarian-like society to protect the climate or something. I wonder if there are any of that's going on. Are they trying to change things and using this as an excuse to do it?
The Great Reset.
The Great Reset, yeah.
I don't know. One of the things. So I mean, I'm a lockdown skeptic, if you like, purely because having looked at the data, I just don't think it's worked. Well, I think it's actually been counterproductive. It's quite a broad spectrum, our side of the believer or skeptic about lockdown. There's the full kind of Bill Gates wants to put microchips under our skin, and it was purposefully released by the Chinese and that. There is one end of the spectrum. I got to say, I am pretty much completely over the opposite end of the spectrum. I always believe in cock up rather than conspiracy. I wouldn't be surprised at all, actually, and this is total speculation, but I wouldn't be surprised at all, actually, if it did originate in a lab as an accident, sort of escaped by accident. I wouldn't, rather than an experiment looking into viruses that accidentally escaped. I could easily believe that, particularly given it happened to break out in Wuhan, where the virology lab is. That wouldn't surprise me. But the idea of it being intentional, or being used as a kind of a Trojan horse for the Greens to further their kind of Great Reset, that I find impossible to believe. But if you were to say, which I think you are saying, that they're sort of just taking advantage of the situation to further the kind of the BLM and the Green agenda, particularly in election year, then I think, as you say, you make the most of the circumstances you've got, and here you've got a circumstance where governments don't look capable, and you do look as though you have the opportunity to have a new normal. So you want it to be your kind of new normal. Yeah, no, that I'd agree, but none of the conspiracy theories, I have to say, I hate to be rooted on this, and I find them kind of amusing, but unbelievable. Yeah, but the Greens, I mean, the one thing is, funnily enough, if that's their intention, it doesn't seem to work very well. Looking at recent polling, it looks as though environmental concerns have really slipped down the agenda in terms of what people are worried about. People are much more worried about, obviously their health, but also the economy, how they're going to get their jobs back. And it sounds like a lot of the fixation with the net zero idea, which I could talk about for about 10 hours. A lot of the fixation with that idea turns out to be a bit of a luxury of good times.
Yeah, I mean, I don't think that they're necessarily concerned with public opinion. I think that's why they're trying to shoehorn Soviets, or they call them citizens' assemblies, don't they? But I call them Soviets because that's what they are, into play here. Trying to have little teams of people who are in support of their agenda, make all of the decisions, and get 100 random people from around the country to come and sit there and sign off on it.
Oh God, yeah.
Yeah,
this has been going on for years. I mean, I'm not sure I've seen much sign of it accelerating in the last 6 months. The left has done its best to take over, academia and the media. and they're like that fungus that takes over a carpenter ant. And, they take over the behaviour so that they can sort of spread the spore as widely as possible. It works absolutely brilliantly. But I mean, the last 6 months, if I'm not sure, I think a lot of what the left has really tried to do. I say the left. I mean, I don't think I'm particularly right. I think I'm fairly centrist. But just sort of watching, a lot of, especially what's going on in the States, a lot of the riots over there, and looking at how Extinction Rebellion is trying not to let a good crisis go to waste. I think they're overplaying their hands a lot. I suspect public opinion might think this wasn't the time to do it, and we're sort of seeing them slightly for what they are. I wonder if they're so shrill about it, they're sort of scouring out their own support, and they're sort of giving up good footing for what they think is a killing blow. But actually, I think they might sort of lose their balance a bit. We'll see. It does look as though, certainly in America, it certainly looks as though they've overplayed their hand quite a bit in terms of the anti-far riots. I think a lot of just middle America wants it all over now. I guess we'll find out soon enough.
Absolutely. Victor Davis Hanson at Stanford makes a good and perhaps worrying point about that, and it's that Middle America is so sick and tired of Antifa, BLM, the sort of Democrat-sponsored mayhem, that they may just vote for Biden or not vote at all, because they're hoping that maybe if Trump is removed, maybe it'll all go away. I don't think that it will, but that's his theory, and he's someone who's worth listening to.
Yeah, but this I mean, when people aren't happy with their circumstance, and you give them a single button they can press that will make the world different, they will press the button. And without going into Brexit, I think there were some people, I didn't say all at all, there were some people who they weren't happy with the direction their life was taking and the way that the kind of world they were growing up in and so forth. And that was a button they could press, and they pressed it. And maybe that will happen in the American elections as well, in that people aren't happy, and the one thing they can do is change the president. So maybe they'll vote to change the president. I mean, I think we could talk for hours about how good Trump is. I think it's very easy to make an argument that he's not a particularly nice man, but he's I think a very good president. The diametric opposite of his predecessor. But it's quite a subtle argument to make for people who think they're voting for the man, and who this is their once every 4 years you get a chance to either sort of carry on in the direction you were on, or change tracks, and they might just choose to change tracks. Unfortunately, I think they would be voting to change tracks to somebody who would make the things they're dissatisfied about worse. But again, these are sort of subtle arguments that are difficult to get across in a campaign.
Absolutely. I think Trump and Brexit were both reactions to a sense of lack of control. I know it's easy to make mistakes when you're trying to compare such different places as the United States and Britain, but I do think there was similar things going on there, and that Trump
take that
was
control. I mean, just like we were talking about with COVID, people instinctively want to feel agency. They want to feel they're not just being buffeted around on waves and wind. And if you give them levers they can pull and buttons they can press, then they will tend to press and pull them. That's just human nature.
Yeah.
By the way, that's leaving aside what I think about Brexit itself. But my point was not about Brexit specifically. My point was about, if you give people every now and then the opportunity to change things, if they aren't happy, even if things aren't necessarily in their in their own interests. And I'm not saying Brexit isn't, but they will vote literally just for change.
Yeah, that's the democratic safety valve, isn't it? You voted for Remain, didn't you?
I did. I voted Remain. I thought about it long and hard, and I wasn't, particularly convinced Remainer. And the day after the poll results were announced, if they'd rerun it, I would have voted Leave, because And if you have a referendum, then you have to enact it. I can't believe we're still talking about it 4.5 years later. It's absolutely shambolic. I mean, I voted for Remain, I've got to say, for very sort of non-philosophical, non-political reasons. The EU never got in my way. Things were very calm before 2016. And, although I think it's got lots of flaws, life seemed to function pretty well, basically. There's lots of things I wouldn't invent the way they are if I was in control. I don't think you'd sit down and plan, the streetscape of London if you had a blank canvas, but these things just sort of grow up and end up the way they are, and they seem to work pretty well. And same until recently with the British political system. I don't think I would sit down and come up with the House of Lords and, voting in corridors and, select committees reporting in a fairly random way. But normally it actually works pretty well. It's not something you design, but, I like to generally kind of just leave good enough alone. And I was a bit fearful when people said it's going to be the easiest negotiation in history. We hold all the cards. That just made me instinctively nervous. So, I didn't particularly feel strongly either way. And the moment we voted, we just need to get on with it. I can't believe it's 2020, more than a full Olympic cycle later. And we're still talking about it. So I desperately, like COVID, I just want it to be over. I just want to get back to normal and talk about something different.
Yeah, I think too few people on the Brexit side would recognise your position as quite a Burkean anti-revolutionary conservative position, really, which is that things are working as they are and revolutions seldom end well, and no matter how you look at it, extracting Britain from the European Union was a revolution of sorts.
Yeah. I think they're noble, actually. I mean, most of my friends voted leave. And, it was on philosophical grounds of wanting to take back sovereignty. I personally am perfectly happy to give up a bit of sovereignty to have a bit more agency, to have a seat at a bigger table. But I think it's noble. I mean, during my lifetime, in wars, for example, whenever we've tried to change situations and take back control, we haven't always left things better. I'm thinking of Iraq, Libya, and so on. Sometimes a very imperfect, flawed system is better than the system you replace it with. So that's why I was just instinctively nervous about not leaving well enough alone. But we made the decision, absolutely no sour grapes at all. And like I said, I think the worst thing we could have possibly done was rerun it. So I'm very glad that didn't happen. And now we just need to go through this sort of Goethe-Dämmerung we're going through at the moment, even if it means a bit of a clash. And I hope everyone will see sense and we can sort of get on with life again and finally talk about something different. I don't know what the newspapers are going to do next year. If Brexit's sorted out and there isn't a substantial second wave of COVID, the media's probably forgotten what else you write about. It's probably back to Harry and Meghan and miracle diet plans after that.
Oh, I'll take that.
Yeah, me too.
And then I can return to reading fiction and things which I don't really do anymore.
Me too. I've got a pile of books by my bed. The idea that I'm spending so many hours each week reading epidemiology papers is absolutely ridiculous. I've never read any of that stuff before about April, probably March actually. And I'm looking forward to never reading another one again. Yeah, the idea that we know things like, everyone's very sniffy if charts don't have log y-axes. All of us know about T cells and B cells and different types of antibody, and we've all got very, very, very strong opinions on things that we had absolutely no idea about 6 months ago, and that we all have certainly forgotten in a year's time. Yeah, I really want normal life back as quickly as possible.
Yeah, all these new terms like nosocomial and infectious dose and all this sort of stuff, which
exactly. And also just I also want a little bit of dignity back for our government. I mean, just watching the cock up after cock up, then this is a national humiliation of the track and trace system, the contact tracing system. I mean, it was obvious from day one that was going to be a total turkey, and it was just a slow motion car crash. I just want it to be gone, partly because there's fewer things that the government will cock up then.
Yeah, just to move on then to something which I hope they won't cock up and which I suspect will be discussed quite a lot in the next 6 months in the media, the financial situation. Now, as everyone's aware who's listening, you work in finance, so it's not something alien to you. Just before we pressed record, you were telling me that you feel quite optimistic about the financial situation, which perhaps makes you a bit of an outlier.
That's to say the least. I think I'm the last optimist left, to be honest. I mean, so as it stands now, let's assume, touch wood, that there won't be a significant second wave, and that actually the government can kind of stand down some of its interventions, and we gradually do get back to normal life. What we'll be left with, I think, is probably a deficit something like 300, maybe slightly over 300 billion, versus what we'd have hoped at the beginning of the year. So that's kind of a hole that you would think needs to be filled. We need to repair consumer confidence, and we need to repair employment. I was pointing out in May that these numbers are so difficult to get your head around. It's almost as difficult for the man on the street to get your head around 300 billion as it is to get your head around a virus that's 1/10,000th of a millimeter. So, I mean, in kind of comparators that the man on the street might understand, this is about 10 Brexit bills. That's a number that was on the front pages for about 4 years. Well, the lockdown intervention is going to cost us about 10 Brexit bills, but we are trying to finance that as a government at a time when interest rates have never been lower. So I think the government can probably finance that deficit at about 0.25% interest rate. So the interest costs on that extra deficit are only going to be about 750 million a year, which sounds a horrific amount of money. But in the context of national GDP, I don't say we'll be lost in the noise, but it's better to just tolerate those extra interest costs and focus on productivity to kind of erode it, rather than looking at raising taxes to choke off the recovery. And I think Rishi Sunak has been one of the discoveries of this year, and I suspect he'll come to just that conclusion. And just looking at the ONS figures this morning, it looks like consumer spending is bouncing back at a rate of knots. Retail spending is 2% higher than it was before the epidemic now. So it does look like there is scope to allow people's confidence to recover the moment they think the coast is clear. Just as in the summer, the moment people thought it was safe to go back in restaurants, they came back to restaurants. The restaurants were all full again, the bars were full again. People have still got the will to get the economy back on its feet if they just think the coast is clear. And on employment, like I say, I'm probably more of an optimist than you on the furloughing scheme, having retained a lot of employment. I think that if the rest of the economy looks like it's recovering, and in particular if our kind of export partners are recovering as well, I'm much more of a kind of a V-shaped recovery than a kind of an L shape or U shape, all these other different shapes. I can quite believe how, just like after the Roaring '20s, people think, my God, I survived First World War and Spanish flu. Let's have a bottle of champagne and celebrate. Confidence can return very quickly once people think they're out of the woods. So I don't think it's worth the government overreacting to the extra deficit. It's a one-off structural increase that most of their peers have got as well. So it shouldn't even move the currency very much. I think they should just put that behind them, focus on productivity, focus on retaining employment. And I think, within maybe a year, maybe 18 months, the economy will be back to where it would have been if COVID had never happened. So I am definitely at the optimistic end of any opinion you'll hear from anyone who works in finance. But I can see that as being a pretty reasonable narrative.
Fantastic.
It hasn't happened yet, but
Sure.
I can see it making sense.
Yeah, I mean, you make a strong case. I mean, it's a couple of things. I suppose the 10 Brexit bills. I would say it's 10 Brexit bills plus losses, and I wonder politically if Rishi will be able to do anything other than raise taxes, and that's raising taxes from the starting point of us having a 50-year high tax burden. So I think that's what what makes me little cautious.
Yeah, well, I don't know. I think it would be a mistake. I think it would be a real mistake now, just when you want people to be investing as much as possible. You want as few kind of chocks under the wheels of recovery as possible. I think putting up taxes would be a horrendous mistake. You know, if you look at what Ireland did when they wanted to rebuild their economy, you know, low taxes is what got the Irish economy moving in our lifetimes. And frankly, the lower the taxes are, down to a certain point, the better. I mean, I'm not sure they need to go that much lower, but I think increasing them would send a really bad sign, and it would put sand in the engine of an engine that's going to be it'd be difficult to start up anyway. The last thing it needs is more resistance. So I think that would be a really bad mistake. And also I think, well, why pay it off? You've got this extra deficit. Fine, structurally, it's a little bit, we're running with higher deficits than we used to. So is everybody else. And as long as we're not the only super indebted nation, I think we should just tolerate it and worry about it, you know, when the sky's blue and the sun's shining again. This definitely wouldn't be the time, I don't think, to immediately come out of the COVID crisis, probably the Brexit crisis, and then to worry about trying to pay debt down. I think that would be, I mean, I'm a real kind of Keynesian. I think just open the taps, get people spending and confident, get the economy moving, have it running fairly hot, focus on productivity, and maybe worry about maybe balancing the books a bit further down the line. I don't think there's a magic money tree, and this is a one-off, you know, structural change that I think we're better to kind of tolerate for a while rather than worry about from day one.
Well, I sincerely hope you're right. I think I take a slightly different view, which is like more kind of Austrian than Keynesian. But I do think your example from Ireland is a very good one. I was in Ireland during the Celtic Tiger, and it worked. You know, I still encounter people now who make comments about the corporation tax rate and how, you know, it should be raised. And I think, no, that's not the way to go. Definitely not the way to go. But that's already been mooted in the press here in recent weeks, and that's quite worrying. I think it may even have been mooted in government, but I don't know that for sure. I can't remember. I don't know if you've heard anything.
It's one of those things that just sounds prudent, doesn't it? Because, you know, we run our own households and our own budgets. You think, well, the prudent thing to do is to live within your means. But, you know, every pound that a government saves is not going into that economy. So, you know, the public pound is taken from the private purse, as it were. You know, so it's not like running a household. Even though economics actually means, you know, rules of the house in Greek, it's not like running a household at all. Technically they should just, I think, work out like, how do we let the economy run hot? I think Ireland, this is probably going down a bit of a rabbit hole we don't want to go down, but I think they probably let it run too hot, and probably too much of their GDP is just nothing but royalties, never actually properly pass through the economy. I don't think we need to go down the Irish route, but I think they do make the case that, you know, if you send out the signal that you're open for business, then the business comes. So again, I'm heartened that we seem to have someone, you know, in control of the public purse. He seems to have his head screwed on right. He seems a very capable guy, Rishi Sunak. He's obviously very popular, and I think he's someone who I have a lot of confidence in.
Do you think that he is perhaps the man to take over?
Oh gosh. Well, if for whatever reason Boris couldn't, he would be the front runner, I'm sure. He hasn't put a foot wrong. He hasn't got any of the baggage from the Theresa May years or the David Cameron years. You know, he never stabbed anyone in the front or the back. You know, he's smart, presentable, you know, dishy-rishy, young. You know, he's, you know, first BAME Prime Minister. How fantastic would that be? The Tories will have produced, you know, 2 female prime ministers and a BAME prime minister. Not that that's the reason he should be selected, but it would be, I think it would be absolutely wonderful. And I think he's about the smartest cookie we've had for a long time in that job. He's convincing. You know, he's cut his teeth outside government, and, you know, having been parachuted in, what was it, a month before the COVID crisis? You know, as soon as he had his hand on the tiller, he got the furlough scheme up and running quickly. You know, he had a suspension of business rates. He seemed to get the universal credit scheme working with the Home Office. Everything he's touched seems to have gone right. And then when Boris wants people back in the economy, it was his scheme overwhelmingly that got people out of their houses. So, I mean, just purely on merit, you'd say that he'd be who your smart money's on. But I mean, on Boris, it's extraordinary that less than a year after winning an 80-seat majority, we're even having this conversation. Talking as what if Boris, as it were, doesn't last. I hope we do sort of see the old. I mean, I have very mixed feelings about Boris personally, but it's for all the promise that there was last December with such a strong majority, and with someone who, for all of his faults, his bombast is a fantastic way of getting confidence back into the people and sort of lighting a fire under the country and probably under the economy as well. I hope his best days lie ahead of him.
I'm a pessimist about that one too.
Oh yeah.
I think he's on the way out the door.
Do you?
Yeah.
Do you subscribe to the idea that he's basically a campaigner, but not one who should be in charge of the actual kind of wheel of government?
Yeah.
He doesn't seem very good with engaging. I mean, one thing I will say, he doesn't seem to be very good at sort of tackling head-on difficult decision-making. I mean, I think he's a fantastic campaigner, but the problem is that if you're Prime Minister, by definition, all of the difficult decisions have been made before they get to you. So he's probably kind of learning on the job slightly, and it's maybe unfortunate. Normally, he would have a cabinet guiding him through this. He'd have interaction with the backbenchers to guide them. And it's a nightmare, really, that the first really difficult thing he's had to tackle has coincided with Parliament being suspended, trying to run cabinet on Zoom. Absolutely, it's almost like a tragedy, or the circumstances that have lined up to sort of expose some of Boris's weaker points. But it might be that if COVID's behind us soon, maybe his strengths will come to the fore in the closing furlong of Brexit negotiations. And if Brexit and COVID are behind us, I think Boris might be just what we need next year. So I think once those two are behind us, the fundamental thing that the country will need is G'ing up, and he is, I think, just the ticket for that. So I don't know. I kind of blow hot and cold on Boris, but there's no doubting his charisma, and that might charisma actually can produce results that uncharismatic people can't produce. And it might be that his skills are exactly what's needed in 2021, even though I think he probably hasn't had a great 2020.
Yeah, I think, yes, we do need a charismatic, optimistic leader in some scenarios, but I think the problem with Boris is his personality. I think he's quite a vain man who wants to be liked, and that is a disastrous way to approach negotiations. For example, I think he's too likely to say yes where he should say no, and he seems to go missing quite a lot in action. So that's another.
It's funny because everyone originally was comparing him to Trump. There's all the graffiti of Trump and Boris kissing, and there was all the cartoonists stressed the fact that they're very similar, as it were, right-wing libertarian, bombastic characters, but actually they seem to have completely diverged in 2020. And in the closing furlongs of his first presidential term, it looks like Trump, like having resisted the siren call to create a war in the Middle East, it looks like he's actually maybe cracked the nut of Middle East peace. Absolutely extraordinary. And like you say, Boris tends to go missing in action. I guess what we don't know from outside is how much COVID knocked him for six. He was in intensive care, and there's speculation about how much he's got his health back. It's probably knocked his confidence. And I think he probably thought he'd have a few months to find his feet before the first crisis, and that just never happened. So it's been like a tragedy written to expose his weak points.
Yeah, it could be like Woodrow Wilson, who got the Spanish flu, and we only found out quite a long time after just how badly it affected him. And his decision making in Versailles, for example. But we'll see. I just hope that that Boris does recover. You know, I'm pissed off with a lot of what's gone on, but obviously I want the best for the country, and he is our leader.
Yeah. Well, I
Yeah.
think health-wise, I think he looks like he's got his health back. I think the problem is he's had 6 months of people telling him he's doing a crap job in the press, and it's probably just he's probably a bit thin-skinned, and you know, he probably always thought he was doing the right thing, and he's probably just a bit alarmed that that view isn't necessarily shared. So, like I say, I think he might have a real off year, but it might well be that his skills are exactly what's needed next year. So it's very difficult. In the middle of a crisis, it's very difficult to work out the way history will judge both the episode itself, how different normality will be afterwards, and how well the protagonists have done. You need perspective for all three of those things. So, you know, although I personally wasn't a huge pro Borisite, I do recognise his skills, and you know, I do recognise that although they haven't been what we needed this year, to say the least, you know, they might be what's needed next year. I mean, coming back to what we said about the kind of legislative dead man's switch, you know, if only we'd done the Swedish route, which was when there's a public health crisis, the reins of government are handed to the heads of public health. You know, literally the reins of government in Sweden were handed to Giesecke and Tegman. Now, meanwhile, we have SAGE committees reporting to CMOs, reporting to CSOs, reporting to quads, none of whom have got any science qualifications, nor have the key SPADs, reporting to a historian and journalist prime minister. And those are the people making the decisions. It's set up to fail. We've got a health minister who hasn't got any health qualifications. You know, in Sweden, they had an epidemiologist running their response, guided by another epidemiologist. So which of those systems is set up to succeed and which is set up to fail?
Yeah, and that's very insightful, and I think it's very obvious what the answer is to that question. I would add, just going back to the start of the conversation, that an economist should have been present, and I would have hoped that was the case in Sweden too. I don't like the idea of you know, just epidemiologists telling us what's going on when they don't know anything about economics, and they don't know anything about balancing policies in general.
Yes. Yep. No, fair. That's a very fair point. The broad. One thing I've never worked out is who actually appoints the people who sit on the SAGE committee. That is, I think, that is, well, it may be opaque. It may be that I haven't stumbled across how they're appointed. But you know, if you were to sit down and design one, you would want kind of not competing teams of epidemiologists, but you'd want people who are going to take not all the same view. Yeah, you'd want economists. You'd want cancer specialists who can say, listen, we can only miss, say, 3 to 4 weeks of cancer referrals before the cancer deaths start picking up, and this is the pace at which they'll pick up. You'd want, as I understand it, SAGE never even had any immunologists on it. So the epidemiologists who tracked the outbreak of disease, they didn't necessarily even have the best information about what the nature of the virus was likely to be. I mean, again, maybe this will be something for the Royal Commission to look at when the inquiry starts. But you know, if we spent a bit more time thinking about the right constitution, you know, there was the right makeup of the SAGE committee, that might have actually solved a lot of our problems. And you know, an economist, certainly, not necessarily to look at the money side, but to look at, it's the science of trade-offs, economics. And my God, are we going to have some trade-offs once all the lockdown death toll becomes clearer? You know, we'll rue the day that we never had, we never did the cost-benefit analysis. I also just really, I think, relatively basic levels of statistics on things like the contact tracing tactics and strategy, because it looked to me from day one like this had absolutely no chance of working. But it sounds like we were kind of bounced into it with the assumption it would work. And I've never been able to work out how they thought contact tracing would make the blindness, well, any useful amount of difference. But it's, even yesterday, you know, there's in this select committee, you know, is it Baroness Harding, Dina Harding? Yeah. You know, it's all on the premise that contact tracing is the way to beat this disease, beat this virus, whatever they say. you were talking about, tens of millions of tests, whatever it is, focused on contact tracing. It's still not clear to me mathematically that is any useful way of controlling the spread of it. So again, maybe there should have been more people whose only task was to say, hey, listen, the recommendation is to go down this route. Is it likely to work? And if it doesn't work, what are the hurdles that it's likely to knock over? So yeah, there's all kinds of ways that hopefully next time we have a situation like this, we'll do things better. It's set up for expert failure the way it's been done.
Well, I think that is more excellent analysis there, Alistair. Thank you. And I think maybe we will call it a day there, and perhaps have another conversation another time.
Love to, absolutely. Well, I've done a few of these podcasts over the last few months, and I always say, well, I'm sure it'll be over in 2 or 3 weeks, or 3 or 4 weeks, and 6 months later, here we are still. So, in the nicest possible way, I'd love to talk to you again publicly. And I hope that when we do, it's not to discuss COVID, because I hope it's all in the rearview mirror by then. But thank you for having me on.
Amen to that. Thank you very much, Alistair. All the best.
Thank you very much indeed. Cheers, Ronan.